friends. Welcome to the Mama Doc, Baby Doc podcast. We're glad you've joined us for another episode. I'm Renda, an OBGYN physician, and I'm here today with my daughter, Rachel, who is a pediatrician.
Hi, everyone. Hello, Mom.
Hi. All right. So definitely it is winter here in Alaska. We have
Yeah.
had snow. It's getting dark. Have you had snow yet in Colorado, Rachel?
Yeah, it snowed actually last night for the first time. I shed a couple tears. I'm not going to lie about
I like
it.
snow. I think it's beautiful.
No, I hate the snow so much. It just ruins it literally ruins everything. I hate it. But it's better than last year. So last year, actually almost to the day, it was the first snow here, and I bawled like having a panic attack. Couldn't breathe. I was crying so hard because we were supposed to go to Denver for a football game, and I didn't want to drive
That's
there in the
right.
snow. And so I literally had a panic attack crying so hard about it.
That's really
So I
funny.
handled it a little better this time, which is good. But yes, it snowed a little bit last
For
night,
those of
unfortunately.
you that don't know, I raised Rachel in Florida. So that's part of her issue right there.
Yeah,
I
I lived
absolutely
there
love
from
snow though.
1 years old to 18, okay? My
Right.
whole
Right.
growing up time,
Right.
and I am not a fan of the snow.
Right.
I am a
Well,
Floridian at heart.
I love the snow. So there you go. There's that.
But one of my favorite things to do when it snows is not go
Mhm.
outside in it, but really just sit by the fire and eat.
Mhm. Ah.
Eat anything and everything I
That's
can
right.
get. Hot
That's right.
chocolate, candy canes, brownies, cookies.
Okay. So you use
All
the
the things.
winter time as a time to like bulk up, right?
Yeah, like a bear. Pad up.
Yeah. Except they're sleeping through
Exactly.
winter. They're hibernating. They're not actually getting bigger, but that's okay.
I mean, it's the time
That's
of
funny.
year. You have Halloween, you have Thanksgiving, you have Christmas.
It
There's
is
so
that
many
time of year.
yummy
You're right.
things.
Right. And it's kind of
Um,
appropriate then that our episode today, the topic for our episode today, right? It's appropriate.
it is, yeah. We're going to talk about weight gain and pregnancy today. We're going to talk about how much weight you can or you gain.
Yeah. Yeah. So if you're pregnant, I mean, maybe you have been looking forward to putting on pounds after years of dieting, years of dieting to try to keep them off. Well, now that you're pregnant, you can gain a
Mhm.
little, right? Or maybe you've been dreading watching the numbers on the scale creep up. But either way, for
Yeah.
most moms to be, weight gain is not only a reality during pregnancy, but it's a necessity, right? I mean, gaining the correct amount of weight is vital to growing a healthy baby. Yeah.
Yeah, I remember when I was pregnant with JJ weighing myself, and just when I got over 200 pounds, I cried. I was like, no. And you read all
Yeah.
these things about like this is how much weight you should gain, and it's this much. And I gained more than that. I feel like most people do. But there's like, I feel like most people have questions about weight gain and pregnancy.
Right.
You know,
Right.
what's the right amount? How much is too much? How much is too little? Because you don't want to not gain enough.
Right.
How fast should you gain weight? Because you don't want to gain it all too quickly. And then if you do gain weight, like I said, I got over 200 pounds. I was like, will you be able to lose it all? You wonder, like, are you going to be able to come back from this?
Right. And the short answer to that last question is yes. If you gain the right amount of weight at the right rate on the right type of foods, then yes, you should be able to take off most of it, if not all of it, after you deliver your baby. Right.
Yeah, I feel like if there's ever a legitimate reason to gain a bunch of weight, pregnancy is it, right?
Yeah, absolutely. Right.
You're growing a baby, and the baby has to grow too. Your belly gets bigger, like everything is growing.
Right.
But I do know that gaining too much weight can give problems for moms and babies too. Also, not gaining enough weight can be bad too. So
Right.
tell us, what's the perfect weight gain formula in pregnancy?
Well, actually, since every pregnant woman and every pregnant body is different, the perfect weight gain formula can actually vary quite a bit from person to person. The number of pounds that we recommend you gain during pregnancy has a lot to do with your pre pregnancy weight. So, first of all, your provider, your midwife, or your doctor is going to recommend the weight gain target that's right for you. And no matter what we say on this podcast, you should follow the guidelines set by your personal physician or your midwife. I mean, they know you, they know your medical history. Now, with that being said, a general guideline is that weight gain recommendations are based on your BMI, your body mass index, and that is how we determine how much weight you should gain during your pregnancy.
Exactly. Yep. And if you don't know your BMI, you can look it up. There's lots of BMI
Yeah.
apps. You can Google a BMI calculator, or you can really ask your provider. There is a way to calculate it. The formula is a little complicated, so really just Google it. It'll calculate it for you. You put in like your weight and your height, and it'll do all the work and pop you out with your BMI number.
Right. So once you know your BMI, then you can determine how much weight you should gain throughout your pregnancy. If your BMI is normal, and that's 18.5 to 25, then more than likely you're going to be advised to gain between 25 and 35 pounds during a normal pregnancy. And that's a standard recommendation for the average weight pregnant woman. Now, if you start out your pregnancy a little bit overweight, let's say your BMI is between 25 and 30, then your goal is probably going to be scaled back a little bit to somewhere between 15 to 25 pounds. If you're someone who is obese when you get pregnant, if your BMI is over 30 when you get pregnant, you may be advised to keep your weight gain total even lower, like under 20 pounds, or maybe even less, depending on your pre pregnancy weight.
Yeah, and what about women who are underweight for their BMI? So, you know, the skinny girls.
Yeah. Yeah, we
We
all
all
know
know a
some of
few of
those,
those.
right?
Yeah.
Right. So
Not
for
us,
women
but
with a yeah, not me. For women with a BMI of less than 18.5, usually we set the target weight gain a little higher for those folks, between 30 and 40 pounds weight gain during pregnancy. And that can be really challenging for some of those women to achieve. Another time when weight gain may be adjusted is for women that are carrying multiples, like twins or triplets. Those moms are going to require a few extra pounds as well, right? You need more weight for
yeah,
more babies. Yeah.
more babies. Yeah. Um, so it's one thing to set an ideal weight gain goal, but it's another to actually do it, right? Ideals are really not always compatible with reality. It can be hard. I know I gained more than the 35 pounds that I should have. There are so many other factors at work, besides just how much mom eats. There's your metabolism, your genetic factors, the level of activity that you do. I know I see on Instagram all the time these pregnant women exercising during their whole pregnancy and like lifting weights. That was not me. I was lucky to get up and down the stairs at work. And then, but there are the pregnancy symptoms too, like nausea and vomiting, and they can make, eating really difficult
Oh,
too. So,
definitely. Absolutely. I mean, heartburn can make it really difficult to eat.
yeah.
Also, the
Mhm.
nausea that women get in that first trimester often causes women to have cravings for high calorie foods that make gaining too much weight really easy to do. I mean,
Yeah.
some women, their nausea is only satiated if they're eating high carbohydrate foods all the time. Now,
That's
all the things that you mentioned play a role in weight gain. So I just tell my patients to do their best to keep an eye on the scale to ensure that they're not losing weight or getting too far off track with their weight gain goals.
Yeah, that's a good recommendation. I know too, some of the weight gain we actually have is from the baby, the placenta, the fluid. So it's not really all you. Can you like talk about that? How much of the weight is
Yeah.
that this baby?
Yeah, so that's a great question. So, an average full term baby is going to weigh about 7.5 pounds. But that's not all, right? You're also carrying a placenta, and an average size placenta is about 1.5 pounds. Now, we all know some babies are bigger, right? And some are smaller,
Mhm.
but an average baby, 7.5 pounds, an average placenta, 1.5 pounds. The amniotic fluid, that big ball of fluid that you're carrying around, is in general about 2 pounds. Most women who are pregnant will also notice that your breasts get a lot bigger. It's
Mhm.
estimated that women are going to gain about 2 pounds in their breasts alone during pregnancy. So you get 2 pounds of boobs. Maternal blood volume. Your maternal blood volume also increases significantly during pregnancy. And women are just going to carry more fluid in their tissues. You might notice that your rings can get a little tight. Of course, your uterus also is getting larger. So, if a woman gains about 30 pounds during her pregnancy, she's really only gaining 7 pounds of fat stores. The rest of that weight gain is all the other stuff: the fluid, the uterus, the breast tissue, the baby,
Yeah.
the amniotic fluid, all that other stuff. So, when you gain 30 pounds, you're really only gaining about 7 pounds of fat stores. Okay.
That's good to know. That's really good. That makes me feel better.
Yeah, good.
I think though I probably gained more than 2 pounds in my boobs during pregnancy, okay? I wish they would have
Yeah.
stayed. They did not, but
Yeah.
I
Yeah.
definitely think I gained more. Um,
Yeah.
okay, so when we talk about weight gain too, we also talk about how it needs to be gradual, right? Like slow and
Right.
steady throughout your pregnancy.
Right.
Because if it's slow and steady, it allows for more gradual stretching of the skin, so you get stretch marks.
Right.
And pounds put on gradually tend to come off easier after delivery too. So when we talk about that, how do we spread that out over pregnancy? So if you're spreading it out over the 40 weeks, are we expected to gain it equally every trimester? Like the 30 pounds, 10 pounds in the first trimester, 10 in the second, 10 in the third? How do we do that?
Yeah. No, I don't think that's even possible. Even if that were possible, that's
Yeah.
really not the best plan, because most women are going to gain most of their weight toward the end of pregnancy. And that makes sense, right? I mean, during the first trimester, the baby is teeny tiny, it's microscopic, which means moms don't really need to increase their caloric intake really at all at that point. So, a good goal for first trimester weight gain is between 2 and 4 pounds. Now, there are a lot of women who won't end up gaining any weight at all in the first trimester. And some women actually will lose a few pounds in the first trimester thanks to all that nausea and vomiting. Also, I notice a lot of my patients, women start to make better food choices once they become pregnant. So they may choose an apple as a snack instead of a bag of potato chips. So those healthier food choices can actually result in a little bit of weight loss in the beginning. Now, some women who have nausea actually gain weight. And it's often because that queasy feeling is comforted by harsh, high starch, high calorie food intake. So don't worry if you are one of those women who ends up gaining more than 4 pounds in the first trimester. It can happen, right?
Yeah, I think that was me. I gained a couple pounds in the first trimester because whenever I got nauseous, that was me too. I was eating like
Eating.
all the candies
Yeah,
and cakes and yeah, cookies. Anytime
right.
John would make meat, I would just like want to die. I could not eat, good healthy food. I wanted to die when he would eat it. So, um, but, also don't panic if you don't gain or if you don't lose weight at first. There's plenty of time, don't worry, in the second, third
Yeah.
trimesters to catch up. um, for those who do gain too much in the first trimester, you might want to start watching kind of what you're eating as you move into the second and third. Hopefully that nausea will go away and you can change up what you're eating, maybe even increase your activity level a little. I know a lot of people say in the second trimester they feel the best that they feel over their whole
Right.
pregnancy. So if
Right.
you do take advantage of that, add a little bit more activity, add more protein to your diet, and less of those high carb foods. Okay, so talk about the second trimester.
Right. So in the second trimester, the baby's getting bigger, which means maternal weight gain is going to start to pick up too. An average weight gain of 1 to 1.5 pounds per week is really expected. So that means 12 to 14 pounds is a normal weight gain for that second trimester. And that's weeks 13 through 28 of your pregnancy.
Yeah. And I gained the most weight in my third trimester. And I think that's probably
Right.
when most people gain the most of their weight. So talk
Absolutely.
about third trimester weight gain.
Yeah, so the third trimester is when the baby is the biggest. The baby's weight gain really takes off. But often maternal weight gain actually slows down a little to an average of just 1 pound per week or 8 to 10 pounds total for that third trimester. Some women are going to find their weight kind of holding steady or even dropping a pound or two, especially at the very end of pregnancy. When the baby is really large, it can push up on your stomach. So there's more heartburn, more acid reflux, and it's actually harder to eat a lot of food. You just get full really quickly.
Yeah. And this might be an unpopular opinion, but I love that feeling of being really full.
I know.
Like
I
right
know.
after Thanksgiving dinner when you're just like stuffed and you feel
Yeah.
so full of food. But anyways, so what do you recommend for weighing yourself when you're pregnant? Because I know some women, maybe me, become totally obsessed with weight, and it can be not healthy, right? Weighing yourself
Right.
multiple times a day, stressing out over it.
Right. Yeah, and I tell my pregnant patients, do not drive yourself crazy over it for sure. Our general recommendation is to weigh yourself at the same time of day, wearing the same amount of clothing and on the same scale, and really only to weigh yourself about once a week. More often than that, you're definitely going to make yourself crazy. I mean, there are day-to-day fluid fluctuations depending on salt content in your food, whether or not you've had a bowel movement, and so many other variables. So a lot of my patients prefer just to wait until their prenatal visits, and that's actually fine too. Visits in early pregnancy are only once a month, and that is perfectly fine for weighing in. But keep in mind, a lot can happen in a month, right?
Yeah, exactly. So when do you get worried about a patient's weight gain being too much? Like when is it an issue?
Right. So if you experience sudden or rapid weight gain in the second or third trimesters, especially if that's accompanied by swelling in your legs, feet, or even worse, if there's swelling in your face or your hands, you should check with your doctor immediately.
Yeah, that can be an indicator of preeclampsia or other pregnancy related complications for sure. So
Right.
that's a
Yeah,
good one.
absolutely. And one more thing I want to mention, dieting to lose weight is never appropriate when you're pregnant. And neither is using any kind of an appetite suppressant pill or drink. I mean, those can be even dangerous. So, if you feel like you've gained too much in pregnancy, you simply can't diet to try to lose weight. Do not cut out specific food groups. We recommend just a healthy diet and eating a variety of foods. I do recommend my pregnant moms make sure they're getting enough protein in their diet, and that can help balance their blood sugar and keep their weight gain in a normal range.
Perfect. Good to know. No dieting when pregnant.
Right. And that's about all I have to say about weight gain and pregnancy. So, the
Nice.
main yeah, the main takeaway I want patients to hear or people to hear is don't stress over it. It's going to be what it is. Just try to make healthy food choices, and your body is going to do what it needs to do to make yourself grow a healthy baby, right? Yeah.
Yay, a healthy baby. That's the goal. Okay, so that's all we have for today. Thanks for joining us. And please come back next week for another episode of Mama Doc, Baby Doc. Bye.
Yay. Okay. Bye, friends.